we do at Beauty Culture is reversing some of the natural aging process just to look like you, but a more youthful version of you. Signs of aging tend to show first around the eyes, sometimes the nasolabial fold, and around the marionette line. And why that's happening is because we're losing the volume from the fat pads through here. We're losing the support, therefore everything sags. And so a lot of times we'll just offer a little bit of support around the tear trough or cheek area, and then we can feather in a little bit of dermal filler and even some smoother twist threads to rejuvenate that area and give it a really nice look without blowing the whole face up with a ton of filler.
So this patient is beautiful. She's maintained really nice anti-aging with her forehead, Botox, her Botox around her crow's feet. She's done a little bit of lip filler. She's stayed on top of getting Halo and BBL, and she uses medical grade skincare. So you wouldn't even believe me if I told you her age because she looks 27 maybe. But today we're going to focus on doing a little bit of tear trough filler because she actually has nice volume through her cheek. She's just starting to see a little bit of that darkness and hollowing throughout here. And then we're also going to support her nasolabial fold because again, she doesn't really need so much cheek filler. It's just a little blushing of filler through here and supporting this pre-jowl sulcus. She is fit and thin, and so this is an area that a lot of people tend to see some hollowing, and so rejuvenating all of those areas is going to give her a really nice supple look.
My filler of choice in this instance is Velour, which is a Vycross technology by Allergan Aesthetics. I blended the product with normal saline and a little bit of 1% lidocaine. Hyaluronic acid dermal fillers do draw a little water to them, so by blending this product, I'm able to get a more full correction and account for how the filler is going to look as it integrates into the tissue. I'm using a cannula technique, which is where I poke one time with a sharp needle to make an entry spot for this blunt, longer cannula. I prefer the cannula technique when rejuvenating the tear trough because it's much safer with the blunt tip being less likely to pierce through any vessel, and it causes significantly less downtime, minimizing the risk of bruising and swelling. One of my tips for making the cannula technique very comfortable is once I get into the correct plane, I aspirate and give a little bit of product. This offers a glide to my cannula to get into the right spot and also gives the patient a little bit of numbing. Otherwise, we just match up this side and do the same exact thing. If the patient can tolerate it, I usually have them open their eyes and look up at the ceiling. This makes their under eye deficit more obvious and it helps guide my treatment. The lateral portion of the tear trough has a lot of lymphatics, so you want to make sure that you're not being too aggressive in that area and also placing too much product. You don't want to put any pressure on those lymphatics. And I always finish with a gentle massage. Moving on to offering a little support to the nasolabial fold and the marionette lines and pre-jowl sulcus, I'm also going to use a cannula technique. I like the TSK cannulas. I typically use the 25 gauge 1.5 inch. I use my introduction needle to pop right through the dermis and let that dilate for a moment, and then I remove that and introduce my cannula. As I'm moving into the correct plane, I again get to where I need to be and I give her a little bit of product. I make sure that that little black dot is facing down. That means that my bevel is down and I want the product to go down instead of up towards the skin surface. After I've let that local anesthetic work just a little bit, I continue to aspirate and advance forward, placing small struts of product to support that fold. My product choice in this case is Juvederm Velour. Velour is Vycross technology, so it's a little bit more tightly linked and not going to draw as much water. What that allows is for us to place it a little bit more superficially without the concern that we're going to have a Tyndall effect, which is the bluish hue that can be seen when dermal fillers placed too close to the surface. Velour also has an 18-month indication, so the longer we can get out of a product, the better. As you can see through the same cannula site, I'm redirecting my product and moving down into the pre-jowl sulcus and marionette line. Since the patient was more deficient on her right side, that's the side I choose to start with. Once I have full correction on that side, I move to the other side. Otherwise, we're just matching up the other side and finishing off the dermal filler portion of this program. I'm drawing up some 1% plain lidocaine and I'm buffing it with a little bit of sodium bicarbonate. I'm going to load this onto the lower lock of the thread and I'm going to go ahead and place that in the nasolabial fold. Here we're using the 1.5 inch twist PDO threads. These threads are made from polydioxanone, which is a strong suture material used in heart surgeries, a lot of orthopedic surgeries, or deep abdominal surgeries. And the benefit of polydioxanone is that it completely absorbs over 4 to 6 months, but it stimulates fibrin and elastin, which is going to then produce more collagen in the skin. They also stimulate new small vessel growth in the face, which is going to stimulate healthier tissue, and they tighten the skin by stimulating the underlying fat and muscle to contract. As you can see, with mindfulness of where blood vessels are, we can essentially place them anywhere in the face to offer the effect. Here we're offering additional smoothness to the nasolabial fold and some volumizing to that prejowl sulcus. We're just going to repeat the process on the other side and we will be done. I have the lidocaine loaded on the thread because if she were to be a little uncomfy as you're placing that, you can give her a little bit of product and then advance your needle. We're using these sterile sharp needles to place the thread, but once we remove the needle, you're leaving just the thread behind. The threads will completely dissolve over the next several months, but the lasting effects of building your own collagen can last another 12 to 15 months. After any injectable in our practice, I always massage using the enhanced post-injection serum. Here's the pan video of the patient before, paying close attention to the hollowness around the eyes and some deep sulcuses underneath the lips. And this is the after, where we see nice supple bright eyes and some more volume around the mouth. She was thrilled with these initial results, but they'll continue to improve over the next 4 to 6 weeks as the filler settles and the threads do their job.